I'm Dr. Seth Hepner. I'm a neurologist practicing at SSM Health Neurosciences. I graduated from University of Pittsburgh Medical School, and I completed residency at Washington University. The types of conditions I see and I treat include things like stroke, like multiple sclerosis. We see a lot of epilepsy, migraine headaches are common, things like Parkinson's disease. We see things like Alzheimer's disease. We see other movement disorders, myasthenia gravis. There's a very wide range of neurologic conditions that we see and treat. Most of our patients are referred by their primary care doctors. Every once in a while we find somebody who refers themselves, but for the most part we are a specialty department, and most insurances do require referral. Stroke care has really advanced quite dramatically in the last few years. It used to be stroke was just an unfortunate thing that happened to people, and there was very little we could do about it. And then in the last 10 years, we've had the invention of TPA, which can reverse stroke symptoms in some folks. And then in the last 2 years even, we've had stunning new research come out about, or groundbreaking new research, I should say, about the treatment of stroke with endovascular therapies, where they go into the vascular system and actually try and fish the clot out. And I've seen some really remarkable outcomes with that. People would have terrible symptoms from their stroke, and they would go for this therapy, and then they'd be completely healed back to normal. So that's been a really exciting breakthrough in the field of neurology. Likewise, the field of MS is getting a lot of attention as well. We're getting a lot of really effective new drugs that we can treat MS. Again, that used to be kind of a bear to treat in the past, and for a long time, all we had was injections for patients, and obviously that wasn't good because nobody likes injecting themselves twice a day. And now in the past, I would say 5 to 10 years, we've gotten a lot of new oral medications that can really help folks and have far fewer side effects as well. So that's come a long way. So one of the real things I like about practicing at SSM Health is I get to set my own schedule. And by that I mean, I don't get dictated. I have 5 minutes for a follow-up and 15 minutes for a new patient. I can spend as much time with my patients as I want. And that's really nice, and I think the patients really enjoy that as well. So if you have a lot of medical issues, we got all the time and you need to take care of them. And the other thing I really like working at SSM is that there's a lot of support staff, and that means that patients get their questions answered quicker. That means that we get results back to the patients faster, and that means we get tests scheduled quicker. And that's all thanks to our very helpful support staff.